for a long requested topic to cover VSP's contact lens programs. So you guys are hearing the very first version. Let us know what you think, if there's any pros, cons, edits, or otherwise, and hopefully you'll get some pearls out of this that you can take home to your practices. So, successful implementation of VSP contact lens benefits. Our learning objectives, we're basically going to walk through all of the major contact lens programs that VSP has. A lot of people are especially interested in the last couple of topics with covered contact lenses and visually necessary contact lenses. And again, try to give you resources to be more efficient in your practices, to offer these benefits to your patients, and fully maximize your benefits of those patients in your practice. And you can use this talk as a resource for staff training and future questions. So let's start with the basics. There's some basic rules for all contact lens benefits with VSP. And the first one is that your contact lens exam is always separate from your well vision exam. It's provided to patients who either are currently wearing or are specifically requesting a contact lens exam. And if you're doing an initial contact lens fitting with a new patient, all of the benefits technically fall within a 90-day window. Things like contact lens insertion and removal training are not separately reimbursed. All your professional fees are included in these models. So I would encourage you, and we'll talk about setting up fee schedules, I would encourage you that you should have a difference between a new fit and a refit, and fees that address the additional time appropriately for things like insertion and removal training, but it's not a separate billable item. VSP is also always excluded things like CRT, ortho-K, and myopia management. We'll talk about that a little more. And we always have to remember the contact lens rule, which requires us to give patients a copy of their contact lens prescription at the end of their fitting, and that is regardless if they ask for it or not. So you should have a system in place where you're handing them a written copy of their prescription. Power requirements. Classic VSP, plus or minus half a diopter somewhere in at least one eye, or one of the following here with prism, anisometropia, cylinder. Some visually necessary tinted lenses do not require a prescription. We'll hit that in that section. But in general, plano cosmetic color lenses are not an acceptable lens for the VSP contact lens program. So the magic half a diopter in some form or another. As I mentioned, CRT, ortho-K, and myopia management are not eligible professional fitting and evaluation services under VSP contact lens plans. Now, that's a separate treatment and private transaction between you and the patient. However, a lot of doctors don't realize that you can use their elective contact lens material allowance toward these benefits. So many doctors just think, okay, well, you can't touch VSP plans for any of these particularly type of fits, but and that's true for the professional side, but you can use their material allowances. So that might be a pearl right there for some of you. Additional exclusions, things that we'll have in our offices, especially if we're doing a lot of contact lens fits. Basically, in-office contracts or warranties, service warranties for damaged lenses, etc. Modification of gas perm lenses or sclerals, routine maintenance, any refitting after the 90-day is technically a private party transaction. Manufacturer's warranties, office visits for pathology, that should go to medical. So whether it's a billable medical or essential medical eye care. So remember, you can have contact lens patients. I just had one come in actually last week. Corneal edema. Corneal edema was secondary to highly deposited lenses. That got transferred, but he came in as a contact lens problem patient, but that got transferred to essential medical eye care because it had a secondary medical condition. Can't charge them for solutions or supplies. And then bandaged contact lenses don't apply, but again, according to the asterisk there, bandaged contact lenses can be billed under essential medical eye care. They can be billed under some major medical eye care or major medicals, but you got to look at your individual contracts for that. But it is eligible under essential medical eye care. Okay, some big practice tips as far as keeping your practice in compliance with everything. And that's the documentation that you have readily available in your practices. The first one should be a printed reference for all of your contact lens usual and customary fitting fees. This should include both elective contact lenses and visually necessary contact lenses. You want to make these very specific, very descriptive. Hopefully none of you have one fee for every single contact lens patient that comes in your office. You should technically have everything ranging from a basic evaluation of an established wearer all the way up to the most specialty lens that you may be fitting in your practice. In my particular office, I have 9 different levels. Those levels are specified on a big part based on the type of lens that's being fit. Again, I separate the difference between a new patient and an established patient, and then the level of care and complexity that could be involved with that fitting, which usually translates to number of visits. But this document should be published, easily accessible if asked for, and clear. And it should match your billing practices. And that document should be for every single patient that goes through your office, regardless if they're private pay, VSP, or any other insurance. That should be one set of fees for everybody. There shouldn't be separate fee schedules for different insurances or private pays versus insurances. Those are major no-nos. Second one is have a published, documented list of your usual and customary contact lens material fees. Most of us will have this in some form for our office staff, but I would encourage you to have one right in the room. I keep both of these documents in my room with me, and I go over this with the patients in conjunction with their explanation of benefits to let them know exactly what they're getting into before, especially they start a new fitting. My particular contact lens material fee sheet will show a single box price. I don't bother with a 6-month supply price because I'm always going to encourage a year supply, but some doctors will have a 6-month supply price just to try to capture some type of sale when the patient says, well, I just want what's covered. But annual supply is especially important. That's what we should be striving for from the chair. Rebates are any applicable rebates to that annual supply, and then I give them their total cost after rebates, and I break it down to cost per day because it's just a way that some people's brains are wired and it helps them understand things. So those 2 tips of if you don't have those documents in print, do it tomorrow, because those should be the gold standards for everything else that we talk about with these programs. Okay, let's go through the different contact lens benefit types, which are contact lens exam copay with materials allowance. This is VSP's current primary offering to clients. This is kind of like they're always going to lead with signature and then go from there. This is the one that they want the clients to take for our patients. Exam and combined contact lens allowance. This was the standard for many years. So you should all be familiar with it. We've all worked with it for a long time, but we'll go over the details and some little intricacies with that plan that some doctors miss. We'll hit the covered contact lens program. and visually necessary contact lenses. So contact lens exam copay with materials allowance. This is what some doctors call just the copay plan. So as we said before, well vision exams, those are all covered separately. They have their own copays if they apply. That's a separate service. And then once you do your well vision exam, the patient has the choice to utilize their material benefits toward either contact lenses or glasses. So with this particular plan, there and all of our reimbursements are always 85% of our usual and customary fees, minus any copays that might apply. So with this particular plan, the copay is toward the exam fitting fees only, not toward materials. Materials are listed as a separate allowance, either $150 or $175. And then, of course, whenever we do a basic contact lens program, that is in lieu of their lenses and frames. So they will cancel their lens and frame benefit for that 12-month period after the fitting, or if they recycle in January, based on if it's a monthly plan or an annual plan. Another big tip is when you're doing your billing, you always input your usual and customary fees, full amounts, so that the VSP system then will calculate the discounts appropriately. Don't make the mistake of, if you've got a $100 fitting fee, your staff is putting in $85 in the VSP claim because you're only going to get 15% of $85 instead of 15% of $100. So here is your explanation of benefits that most of us will print out with our patients and have them follow around. Here's what this plan looks like. You've got your $60 copay and then $150 toward materials. Here's another example with a $60 copay and $175 worth of materials. And the third example, this one is actually only a $25 copay with $150 worth of materials. So here is a rundown of how this will play out with VSP, and an important pearl that a fair number of doctors are misunderstanding with the copay plan. And that is the fact that VSP will reimburse you your usual and customary fees at 85% if those fees are above $60. So especially when this plan first came out, many doctors were confused and then upset because they thought that their fitting fees were capped at $60 for that copay. That's not true. So in this example, we see we got an evaluation fee of $100 minus your 15%, that takes you to $85. You have a patient copay of $60, so there's a remaining overage of $25. So you turn around, you bill VSP your usual $100. They will then calculate down to the $85 minus the copay and pay you that additional $25. And here's how it looks when we get it on our explanation of payment. So with this particular patient, we had a $150 professional fee. That gets reduced down to $127.50. So we got $60 from the patient with their copay. We got $67.50 from VSP. Contact lenses were $360. Again, that was a separate benefit that they got $150 paid from VSP, and the patient paid the additional $210. So we stayed whole on our reimbursements at $487.50, which just is reducing our fitting fee by the 15%. So don't forget, if you are over that $60 copay amount or the $25 copay amount, if you see one of those come through, that you should be billing VSP for the remainder of those professional fees if appropriate. So let's go over to exam and combined contact lens allowance. And this is the one that's been around for quite some time. Well vision, again, is covered separately and may have a copay. And this is a combined allowance for both their contact lens fitting fees and materials. There is no copay involved with this program at all. So you basically balance bill the patient for any contact lens or material fees not covered by the plan. And once again, this eliminates their glasses allowance. Should be familiar. This is what they look like. 15% off contact lens exam services before applying whatever amount it is that they're being given toward contact lenses. In this case, $110. In this case, $220. And then it also says, we're going to cover this in a specific example, patient is responsible for contact lens exams services over $60 if the patient receives contact lens exam services only and they don't buy materials from you. And this is going to be an important pearl here in a couple of slides. The VSP Access Indemnity Plan is the same basic setup, but it just looks a little different on our patient reports. But it's still 15% off contact lens services. And then they have a contact lens allowance down there on the bottom. In this case is $100. Another one that looks a little different, but is the same concept, is the Exam Plus with allowance. We see these attached to Medicare plans. In this case, we've got 15% off of contact lens services, and then $500 toward contact lens materials. So let's do some math. Here's a typical case where we're doing a fitting and the patient is also getting material. So we have an evaluation fee of $100 and we have $150 worth of materials. So we've taken our 15% off our evaluation fee. We've got a combined amount of $235 for the evaluation and materials with a patient allowance of $120, which leaves a patient out-of-pocket cost of $115. So your staff at checkout should be doing that calculation and collecting that $115 from the patient. Then we're going to bill VSP, our usual and customary $100. We're going to be reimbursed both the $85 for our fitting as well as the $35 that is the remaining amount after the contact lens material calculations, and that keeps us whole at $235 of total reimbursement. What if the patient says, yep, I really like you, I'm getting my exam and my fitting here to get my prescription renewed or established for that matter, but yeah, I'm going to go somewhere else and get my lenses. Well, if you've got an evaluation fee of $150, we've got then $127.50 after our discounts, and patient out-of-pocket costs is going to be $67.50. Now you bill VSP as before, $150 down to $127.50, and we got our patient out-of-pocket cost combined with a reimbursement of $60 for the $127.50. The key with this is now the patient either goes somewhere else, or even if they come back to your office at a later date, VSP is going to say their benefit was used because you used it for their evaluation fee, which is perfectly fine. But the system now is going to say, oh, there's no more money left. There actually is, but it's going to require a call to VSP to clarify. So, I mean, if someone does walk and I tell them that I'm using their benefit, I'll actually give them the option, and I'll tell you why here at the next slide. Do you want me to use your plan for your fitting? And they say yes. It's like, then I'll warn them. It's like, okay, well, if you try to get your lenses elsewhere, they might say you're denied, and the provider is going to have to call VSP. Here's the reason why I'm always going to offer the patient the choice of whether they want me to bill their VSP. So this is an evaluation fee of $50. So you get the evaluation fee of $50, you're only at $42.50. So that's below the $60 payment that VSP is going to give us for this plan, as they stated, if they get materials only. Which means that if I do that for the patient, the evaluation is covered in full with no patient out-of-pocket cost. Well, that's good. But if the patient then goes to purchase materials elsewhere, VSP will actually deduct the full $60 from their allowance. So they actually lose some money. I don't go into that deep a discussion with people, but what I simplify it down to is if you're not going to get materials through us and you don't want to have to make calls to VSP or mess around with the numbers, just pay your evaluation fee today. And then that leaves you your full 120, 130, whatever amount of money they have toward contact lenses. And in general, with these lower evaluation or progress fees, patients are usually okay with that. They appreciate you helping them guide through the system. And then they don't have headaches or call your office when they go somewhere else and VSP says that their benefits have been used. Okay, Vision Savings Pass is a plan that's out there. This is basically VSP's pretty much straight discount plan that competes with a lot of the discount plans from other vision plan providers. And this one actually works out pretty well for us in the contact lens department because it's just 85% of UNC fitting fees, and we get 100% of our usual and customary for materials. So again, the benefit to the patient, well, you're a VSP patient, so I'm going to give you a 15% discount. So instead of $100, it's $85, but your lenses were still $150, and that is an out-of-pocket cost to you. Because it's a straight discount plan, you actually don't even submit a claim to VSP. Okay, those are the basic plans that we should be seeing pretty much every day, and how to use them properly. Let's move into covered contact lenses. So covered contact lenses, this is usually an additional coverage, a secondary coverage to patients. I have it's Tesla is in my area. They have this as a secondary coverage. And you, as you want to train all your staff, are always looking when they pull for claims to make sure patients don't have secondary coverages. It gets missed in a lot of offices, whether it's a secondary coverage under a spouse or a secondary coverage for safety glasses, or in this case, a secondary coverage for covered contact lenses. Because this is a very nice benefit for the patient. They are covered for their evaluation fees in full and a year's supply of lenses in full. This is what it looks like. It's going to say covered contact lenses, and the copay will be indicated on here of what they will owe to implement that plan. $50 copay is the most common one that I've seen. So keys for us. Your well vision exam is separate, and you are paid up to the allowed amount, and that allowed amount includes both your fitting fees as well as a year's supply of lenses, less the patient's copay. You can't balance bill the patient for the difference between VSP's allowed amounts and your usual and customary fees. And any contact lens fees incurred after that 90-day window, just like all of the other plans, that then becomes a private transaction. Again, a pearl. This is where you have one set of fee schedules that should describe the lens type and complexity that you're fitting, and you shouldn't be playing any games just because they have a covered contact lens plan that you're fitting a different price than you would for a normal spherical lens on somebody else or toric lens on someone else. All the fees should be consistent across all the programs. The fees, the maximum caps for this program are in the provider manual. And this is basically what the chart looks like in there with the fees blotted out for presentation purposes. But I would encourage you to, if you haven't already, go to the manual, print this out. It's one page, laminate it, and you'll know your maximums for both the covered contact lens program and the base visually necessary contact lens program that we're going to talk about next. Here's an example of an EOP for one of these claims. So here we happen to have, this was just a reevaluation of an existing patient. So they had a $50 professional fee, which after your discount went down to $42.50. So you see there's actually a chargeback there because it's less than the $50. An annual supply of spherical lenses was $680, paid in full by VSP. This particular plan, obviously, or this particular lens fell under the caps for the plan. So we were paid the maximum amount that we asked for, which was $722.50. That program then bridges into the one that doctors ask about all the time, which is the visually necessary contact lenses. So visually necessary contact lenses works on the same base rules with very specific patients that are covered in full for specific conditions that are either refractive, so that's the visually necessary base lenses, or usually based on some type of pathology, that's the visually necessary specialty lenses. Patients must be eligible for materials on the date of service. That's important because especially if you're a doctor that maybe neighboring doctors are referring to for specialty lenses, let's say keratoconus, one of the most common conditions that we work with. You want to educate your referring doctors that they don't want to, say, have a keratoconic patient in their practice and then use their VSP for glasses, especially if they're glasses that are basically unusable, and then they refer to another optometrist for a visually necessary contact lens fit because they just burnt their eligibility for that eligibility period. And that unfortunately happens a lot. So I'll have a patient come in and say, I understand that you fit for keratoconus. And I look at them, I say, sure, I do, but your last doctor used your material benefits, so I can't use your visually necessary contact lens plan until it recycles. Copays for visually necessary contact lenses almost always apply. I haven't seen any without a copay. So this, if they have it, will be listed under their standard contact lens allowance. So the top is, this one is an exam plus materials plan at 105, and right below that is a single line item of necessary contact lenses with the copay. If that line item is not on their information sheet, they do not have the coverage. So look for it specifically. It's pretty prominent, but it's not 100%. So visually necessary base lenses. Again, these are for 3 refractive conditions: nystagmus, anisometropia greater than or equal to 3 diopters in any meridian, or high ametropia in either eye greater than plus or minus 10 diopters. And these numbers are based on the spectacle prescription, right? So with some plus, it's going to be lower. With some minus, it's going to be higher. So you got to go by the spectacle prescription before vertexing. Now, patients that are being eligible for base lenses do not have to have an improvement of best corrected visual acuity by 2 lines compared to spectacles. This was a rule that came out a couple of years ago that got a lot of doctors confused. And we're going to talk about it when we get to specialty lenses, but the refractive disorders for base lenses do not have to show an increase in best corrected visual acuity. So that's another important pearl. This is technically the same table as I showed you before, because covered contact lenses and base visually necessary contact lenses have the same annual caps as far as reimbursements. So you have already printed that from advice on the last slide. And some tips when it comes to claim submission. So contact lens reason is going to be necessary contact lenses. We need the appropriate diagnostic code, and we need that spectacle prescription and a prescription on the lab invoice to trigger the system to approve the claim. If those prescriptions aren't in there and they don't meet the parameters, your claim will be denied. Here's an example of an EOP for one of these people. So we got a professional fee of $160. So we got paid our 136 from VSP. We had, looks like this patient only is wearing a lens in one eye because there's only 360 units. So we have $280 in that regard with the $10 copay under the plan for a total reimbursement of $489. Actually, that's including the exam. So I don't know the math of those two line items. Okay, specialty lenses are the same parameters, except now we have to provide improved best corrected visual acuity in comparison to spectacle lenses by 2 lines. And this needs to be recorded in the exam that the 2-line improvement is there compared to spectacles. There are a handful of conditions excluded from this requirement, above and beyond the ones I already mentioned with refractive errors. But this was put in place because these are supposed to be visually necessary as an improvement over glasses, because the concept of a contact lens on the eye improves quality of life over glasses. And unfortunately, this has been an area of abuse, and that's one of the reasons why these rules have come into place to prove that we do have an improvement in acuity. There is an extensive diagnostic list of diagnostic codes that qualify for this program, and these are those diagnostic codes. Again, this is another document you can get right off the PRM. You should have it printed, laminated, and referred to in your contact lens files for billing purposes. Colored contact lenses. Colored contact lenses are appropriate for these handfuls of conditions. And these are usually, forms of abnormal pupils that result in light sensitivity, and the patient is improved by the use of a colored contact lens. In these particular cases, 2 things. There is no requirement, again, for that 2-line improvement. And actually, this is the only case where, if you have an appropriate condition, that you can justify a plano contact lens. So the condition has to match the prescription, and VSP cross-references which ones could be appropriate with a plano lens, because you're simply using the color to create a new stable pupil as opposed to whatever condition the patient is suffering from. Keratoconus. Keratoconus is probably the biggest area that is utilized for this program. So there's some very specific rules for it. You want to have thorough patient histories, keratometry. Again, you need that best correction with refraction and a comparison with the glasses to the contact lenses to show that, yes, this improves quality of life due to the irregular cornea that creates difficulties with the glasses. Of course, slit lamp examination of the cornea and contact lens fitting. And for keratoconus specifically, there is a requirement for either corneal topography or anterior OCT of the cornea. Straight keratometry alone does not qualify. Claim submissions when it comes to specific lenses. So more and more doctors are fitting scleral lenses for our keratoconic patients and irregular corneas. So you have to have the appropriate either 2530 or 2531 code when billing in box 19. And you have to specify that it's a scleral lens and the particular manufacturer brand that you're using. If you don't fill that out correctly, you will be reimbursed at a lower rate. And a big key and another factor of confusion for doctors is that hybrids are not scleral lenses. Scleral lenses are scleral lenses, great big hard lenses that fit on the sclera. A hybrid with a RGP with a soft skirt is not a scleral lens. That is reimbursed at the next level down, which is a V2599. So then you list that as a hybrid and put in your manufacturer brand. Other areas that fit into this, it says up there in the top, proprietary designs. So if you're fitting, say, specialty lenses that are specific for keratoconus, such as a Rose K lens, or other proprietary designs that are non-basic spherical or non-basic toric lenses. They would be classified as a B2599 proprietary design. They have higher costs and higher acquisition costs, and usually higher skill sets when it comes to the fitting. So they are eligible for higher reimbursement levels because of that. Again, if you don't put in that you're doing a hybrid or a proprietary design, you'll get bumped all the way down to a basic spherical gas perm if you were trying to do a rigid lens. Piggyback lenses, we see less of them because of scleral lenses, but there are still people that are intolerant to any hard lens on their eye without some help. Box 19 has to say piggyback lenses, and you have to document in your chart clearly that the patient is unable to tolerate RGP lenses by themselves. Also, this is another area that people kind of forget about with this program. There are conditions of covered benefits over and beyond the visually necessary reimbursements for these particular conditions. Aphakia, high ametropia that can't be fully corrected by the contact lens, presbyopia, there's probably the most commonly used one, readers over distance lenses. That is a secondary billable condition under the visually necessary specialty lens program, and then accommodative binocular or prism requirements. A prescription is required for all these. You can't do Plano for any of this stuff, but in most cases, you wouldn't do Plano. We're doing it for a refractive help to the overall visual system. It is a manual process. You need to call VSP to get a claim number, have all the information available about the patient when you're calling, and request a separate spectacle lens claim within 30 days of a regular fitting, and you have up to a year for a keratoconic patient. This is the basic table of the visually necessary specialty maximums. It's the same exact table as you saw before, except the numbers are going to be different. So the advice from this presentation is, if you haven't already, you're going to be printing 3 things from the manual. You're going to be printing this visually necessary specialty maximums. You're going to print the visually necessary base and covered contact lens maximums, and you're going to print the diagnostic code tables. And those are your little Bibles for doing things correctly. Some additional required documentations and pearls, especially for the pathological patients that are in visually necessary contacts. You want to be, it's all about documentation, documentation, documentation. Material types, what you dispense, trial lenses as well as final lenses with dates, replacement schedules, handling, care, cleaning, all the stuff that we do, but we're not always good about documenting. And there's not as many checks when it comes to our general patients, but there's pretty stringent checks if somebody's looking what you're doing with the visually necessary contact lens programs. So be thorough with your documentation. Other key takeaways: there's no balance billing, just like covered contact lenses. You fall under the maximums. You can't use global fees. You have to separate line items, your contact lens exam and material fees, and you must bill for both to be reimbursed. You can't have somebody say they want a fitting only. VSP will only cover an annual supply. So if you have a maximum allowance, you can't bill for more than annual supply lenses just because there's more money allowed in the allowance. There's no additional reimbursement through any other VSP plan coverages. and just play the straight and narrow as you would with somebody without coverage for your appropriate fitting fee, which should be a higher fee in your fee table because of the complexity and lens use, but it should be the same fee for everybody. And again, you can't use these programs for post-refractive surgery patients for the straight I had LASIK, PRK, or RK. However, there's a lot of patients out there that end up with underlying conditions such as corneal ectasia, deformity, scarring, etc., that now you do have diagnostic codes and appropriate reasons why you would use this program. Again, treatment with for a corneal abrasion of the bandage lens is not eligible under this program. That's going to fall under essential medical eye care. Last few points. I've said this several times, charge your patients the same for a visually necessary contact lens fit as you would a private pay patient or any other vision plan. Have your printed copy of both your fitting fees as well as your material fees. And remember, with the advent of electronic medical records, things live in different places. We have our electronic health records, and we also have our practice management systems. And some information is in one, other information might be in others. So, and then you still might have printed information. So if by some chance you're being asked for proof of appropriate billing for one of these patients, make sure you access all of your different electronic and paper records to give 100% of the information requested. Because doctors just forget, oh yeah, my dispensing is actually in my practice management system, not in my electronic health record. Final reminders, beating the horse of beating the drum of document. Always refer to the provider reference manual for the final and most updated information on these programs. You go to VSP online and then go to manuals, and you can now put in there just contact lenses in the search bar, and we'll take you right to that part of the manual. Or if all else fails, you can call VSP, but they're basically reading the manual, so you have it in front of you. Final word, if you can't produce documentation that it was done, it didn't happen. And that is the number one pearl that I can give you overall. And you can use this presentation as some of the details of what VSP is actually looking for in that regard. So with that, I am going to turn it back over to Stacy so that she can control things, if I can figure out how to do that. Teams.
You can just stop sharing.
Stop sharing, yeah.
You should be good.
All right. What questions does everyone have, if any?
Everybody stay awake.
Dr. Siney?
So I just wanted to confirm, because I guess I was unsure, for things like MiSight for myopia control, I wasn't aware that we could use the allowance towards materials. That seemed new to me. I just want to confirm that I'm understanding that we cannot use it for fitting, but we can use it for materials.
Yes, you can. You can use their regular plan toward their materials, and that's something that a lot of doctors don't realize. So you got your one pearl.
There you go. Thank you.
Dr. Bashir?
I actually had the same question because I have tried it before and I did not get reimbursement for it. So is there some specific way to do it that I wasn't maybe doing right?
I don't know. I don't do myopia control, so I can't speak from experience. I would tell you that, especially now, believe me, this presentation was vetted by more people than God, so it should be eligible. So next time you get a denial, work back with customer service. If you can't get an answer through customer service at this point, you could reach out even to Ambassador to Support to try to help you, because we're the ones that told you to do it.
Okay, that sounds fair.
Absolutely. All right. Dr. Millara?
You mentioned distance-only contacts with a pair of reading glasses. So
Correct.
we can still do, we can have them do the glasses covered if we give them a pair of single vision distance contacts.
That's under visually necessary contact lenses. So let's take a classic case. You got a presbyopic keratoconic. I don't think there's a lot of people that are doing bifocal lenses with keratoconics. So they're going to have a reading need after you fit them for their best corrective visual acuity at distance. And if you call VSP and go through the hoops, you can get a secondary claim to get reading glasses over that contact lens system. That's only the case for visually necessary specialty contact lenses.
Gotcha. Thank you.
Right. Dr. Nguyen?
Hi, I've had a couple of local providers ask me some questions recently about medically necessary contacts. So I just wanted to make sure I was clear on the answer. The first one is if a patient is keratoconic, for example, but in one eye, they're refractable to 20/20, but the other eye is not refractable. So the contact lenses would improve best corrected VAs in one eye, but the other eye is already, refractable 20/20, so the contact lens is not going to improve both eyes. Would they still qualify for medically necessary?
Yes, you only need one eye because we know keratoconus is often very asymmetrical. You need to prove quality of life in at least one eye.
I do have another question, if you don't mind. If a patient gets their routine wellness comprehensive eye exam on one day and you bill VSP for just the routine exam, they don't use their material benefits for glasses, they come back on another day for their contact lens fitting, okay? And do you have to re-document a refraction, or if we're going to try to justify that the medically necessary contacts are improving their VAs by 2 lines, can we show that we did a refraction on another data service?
I
I'm
think it's
kind of in the
gonna.
habit of re-documenting the refraction.
Could you get in trouble? I was going to say you could fall in the 90-day period. I mean, it is a gray zone. So, if you're talking somebody that you saw on Monday and they come in like next month, is it going to be a problem? Probably not. But, if you want to play safe, stick the old numbers in from the last visit, spin 2 dials and redocument it, and then you're right there. So, especially if it's a new fit, maybe a new cone, and there's any question, you're going to see them multiple times. I mean, I usually do that anyway, just because I want to see if there's any changes. But it's not like you have to start from scratch. You can start from where you left off.
One more, if you don't mind. For the covered contact lenses that are not medically necessary, but they just have a copay for the annual exam. In some cases, if you're providing a premium, daily, disposable, multifocal year supply, oftentimes even my cost for the year supply of those premium daily disposable multifocals is higher than the maximum reimbursement for a soft lens. Do you just eat that, or?
So that was a very common and legitimate concern for literally years. And VSP actually addressed, I'd say, the vast majority of that in January. Do you know that they did raise the maximums in January?
Mhm.
So and especially in preparation for this, and I've asked what of the percentages of doctors that are documenting that same complaint since then. It's pretty negligible at this point. Are there going to be parameters that still might fall outside the limits? Yep, it's going to be, and it's more specifically, it's silicone hydrogel daily disposables, because literally when the tables were first made, those lenses didn't even exist. And it took VSP a while to adjust, but now the way the maximums are set up, it should address the vast majority of people. If you get one of those designs where it still doesn't, yeah, you're kind of stuck. All you can do is report it, and the more you report it, the more likely VSP hopefully will pivot sooner than the last adjustment and make it so that you're whole.
Yeah. The only downside is manufacturers are increasing our cost faster and more often and more rapidly than VSP is increasing reimbursements.
They're not necessarily increasing costs, but what they're doing is they're coming out with new designs that have higher costs.
Correct.
With-
Even some of the other ones are increasing as well.
And one of the counters to that legitimately is, you know, okay, the patient wants this lens. Is that the only option? And in many cases, there are other options that work as well or sometimes better. Okay. But for them to try to keep up with 100% of especially something that specialized as silicone hydrogel multifocal is a challenge to the budgeting of that program. And what we don't want to do is lose the whole thing because of a small subset of what I'd consider specialty lenses. So I keep them very aware of it. They're annoyed by me, and they made some good improvements in January. But I would still encourage you to keep reporting specific designs so that that's on their radar.
Thank you.
Yep.
Thanks. Dr. Smiley?
Hey, Jim, Team VSP. Thank you. Jim, as somebody does spend half my day doing specialty contact lenses, you crushed it today. So great job, and great job to Team VSP for developing the program. This is a great presentation. I think doctors will really appreciate it. As somebody that's consulting for contact lens industry, ultra premium contact lenses are coming hard and fast, and VSP is going to be in the same boat they were in January, come fast. So I would encourage VSP to develop a mechanism for either allowing balance billing or allowing doctors to create formularies. Obviously, we will always offer our patients a covered option when it's possible, but the industry is changing faster than VSP responds to it.
No, I'd agree. I mean, if they could come up with a program that would allow, basically, some type of patient responsibility or some type of cap for the program, but then the patient has a responsibility beyond that. And those are actually areas, because I've been involved with them on the brainstorming side. They've looked at those. They have. Those were on the table back last year when we were discussing moving the new tables. Their solution at this point was to adjust the current tables, keep the current system, but keep those suggestions coming, because it might and probably will have to become a more dynamic program in the future. But again, we want to remember this is literally the only program in existence that gives us the benefits that we have available for our patients for these conditions. It's a phenomenal program that nobody else has.
For sure. Duly recognized. There are, I think, 4 or 5 that don't meet the dollar criteria right now, and there will be a lot more coming.
Okay, well, keep them posted.
Any other questions? Okay. Well, before we hop then, I do want to share just a quick survey. If you could scan that QR code, there's only a few questions, but we'd love your feedback on this training since it is a new one, and we've gotten lots of good feedback here right at the end. So anything that comes through here, we'll be sharing back with the product team for feedback as well, and if we need to make any adjustments. So I'll leave this up for just another minute, but if anyone has scanned, then you're welcome to hop. Thank you, Dr. Winnick.
Thank you, guys. I hope that was beneficial to you.
Yeah, great job. Great job.
Thanks, Jim.
Thanks, guys. Good seeing everybody that I saw.
Thanks, Jim. You did a great job.
Appreciate it.
Thank you.
Well done, Jim.
See you
Thank
again in
you.
Vegas.
See you soon. Everyone able
Alright.
to scan? I can hang on for another minute, but if you want to hop Dr. Winnick, you can.
All right. Well, let me know if anything comes up you need me for. I guess I'll see you
Sounds good.
tomorrow.
Yep. Thank you.
Yep.
Bye.
Bye.